Before and after vascular patient case study, primary care perspective. The before-after vascular patient case study illustrates the benefits of an integrated vascular healthcare by describing a fairly typical fragmented patient journey before, in contrast with an integrated vascular patient journey after, as viewed from a primary care perspective.
Meet Mr. Smith. Mr. Smith is a 55-year-old truck driver, married father of 3. He lives in a small town 30 minutes from a tertiary care center. He lives a sedentary lifestyle and has other health issues such as weight, smoking, diabetes, cholesterol, and hypertension. Mr. Smith has recently felt very tired and unusually thirsty. It takes him 2 weeks to see a doctor, where he is referred to a battery of tests and programs at different locations, including blood pressure and smoking cessation. He discusses his test results with his doctor 2.5 weeks later. He receives medications for diabetes, high cholesterol, and blood pressure. 1 week later, Mr. Smith has central chest heaviness extending down his arm while carrying groceries. He ignores the discomfort, which subsides in 15 minutes following rest. 4 weeks later, he is referred to a cardiologist. Before he can see the cardiologist, Mr. Smith has another cardiac event and is rushed to the ER, where he is diagnosed as a myocardial infarction, complicated with congestive heart failure. 2 stents are placed in blocked heart vessels. During his hospital stay, he becomes intermittently delirious, and his family reports that his memory has been declining over the last 3 months. Mr. Smith has follow-up appointments with a cardiologist, his GP, the Diabetes Education Center, a smoking cessation program, blood pressure clinic, a nephrologist, a memory clinic, and cardiac rehab. That's 8 appointments. Mr. Smith finds it challenging to maintain his work schedule and is worried about paying his bills while managing multiple medical appointments. His stress is high trying to balance work, family, and health obligations. He is not aware of any local community-based resources to seek help or further information on how to better manage his condition. With reduced ability to work and no health insurance, he is struggling with financial constraints regarding transportation, costs of medication, and equipment. Mr. Smith is a no-show for the rehab and applies for permanent disability. Mr. Smith is overwhelmed and unable to manage his new circumstances. He is afraid he might die and is unable to understand or control his feelings of anxiety and fear. Mr. Smith finds comfort in his familiar home environment but becomes isolated and feels alone and disconnected. Now let's take a look at the same patient journey, but this time from the perspective of integrated vascular care. Once again, Mr. Smith has recently felt very tired and unusually thirsty. He is assessed by his family physician and a nurse within 24 hours, who are linked to an integrated interprofessional vascular health care team, including specialists via EMR and telehealth. Test results are available right away. Mr. Smith receives health teaching, is informed of community services, reassured, and scheduled for individual office appointments with a member of his healthcare team. The vascular healthcare team takes the time to answer questions and ensure his clarity on next steps. Mr. Smith is encouraged to share his feelings and questions and to seek clarification or understanding on concerns regarding his medical situation. He and his family are engaged in co-creating his care plan with his vascular healthcare team. The plan reflects Mr. Smith and his family's preferences, input, and personal commitments. Mr. Smith receives the following under one roof: nutritional advice with a dietitian, specialist phone consultations via regional vascular health support link, enrollment in a smoking cessation program, home testing advice for blood pressure and blood glucose monitoring, clear health goals and an action plan, assistance with self-management including tools and techniques, one point of contact to discuss any queries or setbacks in following the plan, and proactive monitoring of progress by all members of the vascular healthcare team who are linked through the EMR. Mr. Smith's follow-up visits are coordinated for him. The vascular healthcare team connects Mr. Smith with community-based resources and peer support. When Mr. Smith experiences a cardiac event this time, his team springs into action. An electrocardiogram is arranged, and an appointment with his family physician is made within 24 hours. Mr. Smith has a cardiac catheterization and receives a stent in one blocked heart vessel. He is discharged from hospital within 1 day with various follow-up appointments. His healthcare team is connected with all of his other appointments and treatment providers. Mr. Smith and his immediate family feel empowered through learned self-management techniques, and they support each other in sustaining healthy behaviors. Mr. Smith feels supported in managing his stress, which assists him in recovering and maintaining his health. The After case study depicts the concept of a vascular healthcare team based in a primary care setting, which is able to respond timely and effectively to patient needs, co-creates the approach to patient care in partnership with the patient and family, and coordinates and provides integrated patient care through the engagement of a range of allied healthcare providers, specialist services, community services, and supports.